All right, welcome back, everyone. Thanks for joining us for the Health and Housing panel. I'm Mary Ayala. I'm a director of our Aging Well and Health and Housing program at Enterprise Community Partners. And my work focuses on how housing can be a platform for health, which is not necessarily a new concept, which is one of the things we're going to get into today. It's foundational to a lot of the housing policy that's taken place in our country, from tenant rights to sanitation, building codes. So it's really baked into housing. And we really built on this history in the Enterprise Green Communities update in 2026 and have been since, I would say, at least 2015, but that's probably just when I joined Enterprise and started focusing on the connection between health and housing. So for the 2026 update, we really focused on the fundamentals, like ensuring that there is safe air, clean drinking water, that basic safety is taken into account in affordable housing. And then we really moved towards how we can promote health through resident engagement, building community and agency. So I'm really excited to be joined by an amazing panel today of three different folks who bring perspective on the resident experience of living in affordable housing, applying research into practice, how we can build new building standards that are focused on health and bringing that into policy so that we can start to see this health really prioritized at scale. I'm going to have each of you all introduce yourself before we get into the panel discussion, starting with Matt.
Great. Well, good morning, everyone. My name is Matthew Trowbridge. I'm a physician and a public health researcher at the University of Virginia School of Medicine. I have been working on the health and the built environment connection since I was exposed to it as a young medical student in the late 1990s. I feel like all of today is about like 20 years plus, and I'm like, oh my gosh, I'm part of that. 20 years, I can't believe that. But all kidding aside, I was exposed very fortunately very early in my career, but also in the kind of the arc of this exploration. And I became fascinated with, once I realized that connection, I wanted to do something about it. And I became fascinated with the green building kind of transformation story, and have been trying to figure out how can we leverage that for health for so long. And that's why it's so exciting to be here today and see where green building has started to normalize health. And I know we're going to talk about that in our conversation.
Yeah, definitely. Thanks.
Well, hi, everyone. My name is Ashley Viagbo. I am a development administrator at the ARC Prince George's County. We are an organization dedicated on empowering individuals with intellectual and developmental disabilities, providing support and opportunities to them and their families. A big part of what we do in our programs are our residential programs. And so through working with Enterprise Community Partners and working on one of their grants, we were able to transform 8 of our homes. And it wasn't just another renovation project. It wasn't just another grant. It was truly an experience, a transformative experience, and how we can bridge health and housing together and help a community and a niche population, really, that don't often get looked at, but the need for housing is necessary. So it's an honor to be here and talk with you all about the impact.
Yeah, thanks so much.
Awesome. My name is Jason Hartke. I'm with the International Well Building Institute. I just have to say, first of all, congratulations to Enterprise, 20 years of impact. I had the great fortune of I was with the U.S. Green Building Council at the time. I had a chance to be at Greenbuild when this program was first announced on stage, and it has been incredible. Everyone who was part of it, whether at the beginning, the middle, now, should be very, very proud. It is a seismic moment, and congratulations. At IWBI, I lead global advocacy. Our organization is all about driving a healthy building movement. We do that through our well building standard. It's exclusively focused on human health. Every concept, every strategy, every intervention is trying to drive positive health outcomes. We have seen tremendous uptick in adoption over the last few years. When I started in 2019, we were just announcing that we had hit 500 million square feet of real estate. We're now at 6.5 billion square feet. I'm excited that health really has taken hold as a foundation of how we think about not just our buildings, but our organizations and our communities, and excited about talking about that.
Great, thanks so much. So as y'all can hear, we have three very unique perspectives in terms of health and housing on the panel today. And I wanted to kick off by hearing from everyone on what you're most excited about in terms of affordable housing and health and how you've seen the field evolve to now. So would love to hear kind of the moments of urgency that you're seeing in the field and moments of excitement. And we can start off with Ashley.
All righty. I would say the most exciting, but also the most urgent, was the realization that housing and health are not isolated, that they're truly integrated. Being a person-centered organization, we definitely focus on health and ensuring our residents are taken care of and provided with all that they need. But what was exciting was the realization that, housing helps with that, right? Their health is directly impacted by the home that they live in. And so going through the health action plan, we discovered that it's so intentional in every aspect, starting with the materials that we were using, right? We were learning about the paint and making sure that we're not using paint that is toxic to our residents, or flooring and that material, ensuring that it's not exacerbating underlying chronic conditions that may show up in this community, right? And so that was the interesting aspect of it. And personally, coming from a public health background, I was telling Matt this earlier. It blew my mind to realize, this is an obvious integration. Absolutely. When you live in a good home, in a safe home, in an accessible home, your mental health improves, your emotional health improves, your physical health improves, right? Part of the grant was focused on fall reduction and ensuring that our residents were safe. But we realized this goes beyond physical health, right? We had so many residents who were unable to go outside, or they were stuck in their living rooms, afraid to go to certain parts of their home because of issues that may have come up. And for us, it wasn't just another renovation project. It wasn't just, this pipe burst or there's a leak, fix it. But how does this impact the resident, and making sure they're along on the journey so that their needs are met throughout.
Thank you so much, and I think that's what it's all about.
Well, that's what I would say. What am I excited about? It's everything Ashley just said. I mean, I've been working at this for 20 years, and to have what Ashley just said be have tools like have tools like green communities out there, kind of connecting the gaps for somebody. Obviously, your health is deeply embedded in who you are and what your organization does, and then to have these products finally getting to the point where it's becoming it's not that I have to add on health, but by addressing health, I'm actually addressing my more organization's core mission. Yeah. Yes, that's exactly the point. And I've been saying, I think like any good movement, success happens overnight after 20 years of hard work, right? No, but all kidding aside, I think we've gotten to the point where finally, that's what I saw from green building when I stared at it as like a system that I wanted to understand. Back in the early 2000s when I did work with U.S. Green Building Council, it was genuinely like suddenly the idea that the health and built environment had an impact, that came in the late 1990s. The early 2000s were spent like building that evidence base, like checking our work. And by around 2010, 2009, the answer was clearly, is the built environment and health connected? Yes. Okay, what do we do about it? Public health didn't have an idea. We don't know how to do that. And that's what we started looking, how do you make a market for this? And so looking across and seeing green building and how that could work was really amazing. But the hard work and enterprises, 20 years later, it's taken this long to get to the point where how to do healthy building all the way through the stack, everything from how do investors ask for it, all the way down to how do you build it, How do you know whether it's actually worked? That's finally getting to the point where you can actually deliver that in a way that you're not asking an affordable housing developer to do something hard or unusual. And so that's what's so exciting to me about the 2026 release, which I got to be on the technical advisory group for. It's time to scale, you know? Right. I would joke, like, I've been being invited to talk about the healthy buildings as an innovation topic for 20 years. And so my new joke, actually, when people ask me to do that, I say, like, we've been saying healthy places are innovative since before the first iPhone, right? And that always gets the young people to be like, there was a time when an iPhone didn't exist? It's like, yes. But all kidding aside, it's time to scale. And that's, I'm so excited that's actually finally where we're at.
Same here. And we'll probably talk more about that.
Touch on a couple of things that others have said. First of all, I love what Ashley said in terms of kind of the benefits that we can reap. And they're not just all physical health benefits. We know that healthy buildings drive an uptick in well-being to the tune of 26%. We know that there's satisfaction in the building to the tune of almost 30%. There's an increase of 10% in terms of mental health benefit in healthy buildings. And again, a lot of that is how we think about our air, but it's also about how we think about community and engagement and being with others. And all of that is integrated into the program. The thing I'm probably most excited about, but it's going to be a late reveal. We've been addressing this problem, I think, for about the last 10 years, where there has been tremendous urgency around how do we make sure that high-performance buildings actually includes health. I'm not saying it hasn't been there, but I don't think it has taken the limelight that it needs to take. Obviously, this conversation is all about ands, right? Energy efficiency and healthy materials and all the things that we're talking about on the health side. But, Sean mentioned several times in the storytelling that he did, you don't want to trade off energy savings versus ensuring that your kids don't have asthma attacks. I mean, that is unacceptable. So really drilling down into health and making sure that high performance means healthy high performance, I think has been a 10-year evolution. We've seen it with Enterprise and what they've been able to do to really infuse health interventions and health strategies into their program. We've seen it with the introduction of new standards at ASHRAE, like 241, which is infectious aerosols, and 235, which is indoor environmental quality. So all of our tools to do that are getting stronger. So what am I excited about? I'm excited about exactly what Ashley said, is integration. And I love the way that Krista put it. No trade-offs. Right. We should absolutely not be allowing any trade-offs. This is an all-in-one package. Everything has to be there. It has to be sustainability. It has to be resilience. It has to be energy. It has to be health. All of those things have to be together. And so last but not least, I'm a policy guy. So how do we do that through the policy mechanisms? And I'll tell you, we have a lot of work to do to catch up.
Yeah. Great. Thank you all so much. I think what everyone's hearing is that when we entered the 2026 criteria update, we were approaching health from a very different starting point than we did in 2020 or 2015. And Matt was part of our technical working group and really helping set the vision of what the 2026 update was going to be. So we had a lot of these conversations of what's standard practice, where can we push, where do we want to move things around from the 2020 update? And I think similarly in the partnership that we have with Well that we'll touch on in a minute as well. But I'd love if you could share a little bit about how we approach the 2026 criteria, what's different, and how we're trying to push the field at Enterprise in that way.
Yeah, what I've always enjoyed about when I got introduced to the green building transformation engine, ultimately it's interesting because you have to make sure you're building an effective product. It's like I think you can see in public health we're trained, whether we know it or not, like our theory of change is if I just show you more information, you'll see what I mean. And it takes I'm very fortunate that I had a chance to step out from that and then hear like, well, okay, that's true. We believe you, but how do you make something that actually works for the end? And that's when it really scales. So what I'm excited about, we really were very intentional across I could tell from across all the working groups, but within health, we really wanted to make sure we knew that the market was ready. Like we knew that the how to do things, the materials, like the procedures, it was mature enough that we knew it was time, and I think Enterprise was ready to say, we're ready to raise the bar. Right. But we spent a lot of time trying to really carefully think through that we raised it in the right way. And you heard it in the video. I think it was a nice job. I'm glad to hear that it's resonated. How do you raise the floor, but maintain flexibility, allow people to be able to apply health, not just like as a uniform set of like, you must do these 3 things, but health promotion means, well, what does this community need? Like, how does housing impact health, well-being, mental health, social well-being maximally? I'm proud of the way that the updates do raise the floor, but still empower the kind of practitioners themselves to really kind of exert their own personality in it.
Right. And I'm going to jump to Ashley first, actually, and then come back to the partnership with Well, because building on that, we really try to offer a pathway for resident engagement and for affordable housing developers to work directly with community members and the folks who are being served through the Health Action Plan, which Ashley mentioned earlier. And you all completed one, I believe, in 2023 at the ARC of Prince George.
Yes,
2023 and 2024. Would love to hear more about that impact side and how it also changed your organizational approach to health.
A huge impact. We've now ensured that a focus on our group homes and our residences is within our strategic plan. When we are thinking about any other additional monies or grants that we get for housing, let's stick to this health action framework model because it actually works, right? And it helps us to see health through a wider lens. Something that we really enjoyed was the realization that this can affect so many areas of the resident's life, and it can actually bring our residents together as well. So for context, we have over 44 group homes, and within each home, ideally, is about 4 residents. And really touching on that community aspect for them, ensuring that they had spaces where they could actually connect and they could actually commune and talk with one another. And obviously sometimes in the IDD space, you may not always have residents that can verbalize what they want or what they enjoy, but you can see it and you can see the expressions. I know in one of the homes that we went to go check on that we last worked on, one of the residents, he had a bathroom issue. He had fallen many times in his bathroom. And we incorporated him into the process. Even though he wasn't able to verbalize exactly what he wanted, we knew his favorite color was blue, and we knew he liked a certain backsplash, and obviously making sure the shower is accessible. And so I went into the home, and he couldn't wait to show me his bathroom and how it looked. And we thought to ourselves, man, if we could do this for every home and every resident so that they can have this same feeling and that they can feel comfortable and know that they are truly aging well and in place safely and securely. So it's been a huge part to our organization and a transformative way that we approach home adaptations.
Yeah, thank you for sharing more about that. And when we went into the partnership with Well back in, I think, 2019, maybe we started having that conversation, it was criteria like the Health Action Plan. I think that we were really excited to work with Well around. And back then, I think that was just the start. It's been great to see how that partnership has grown. So Jason, I'd love to hear more, if you could share a little bit more about our partnership and also just build on the importance of standards.
And always happy to cede my time, as they say in this town, to the practitioner and the implementer. So I love to hear those stories. Judy Roden of Rockefeller was the first I had ever heard say this, that partnership is the new leadership. And I've kind of almost amended it, at least in my own mind, taking out the new. Partnership is leadership, period. And, collaboration is a big way to move faster. It's the old line, if you want to, go fast, go alone. If you want to go far, go together. So in 2019, I just started it at IWBI. We were teaming up with Enterprise. I had come from the green building community. I was at USGBC for almost 10 years. And we were saying, how do we make sure that a priority sector like affordable housing is able to move at lightning speed as it relates to these proven, evidence-based health interventions and strategies? And so we said, look, let's get as much of well packed into green communities as we possibly can and move it forward that way. So in 2019, we worked a ton with Kristen Company to do exactly that. It showed up in the 2020 criteria. And we said, what are we going to do for the next time around? Let's do it even, more robustly, more aggressively. And we did that. And for 8 years, I think we have the tool to make sure that affordable housing does exactly what we want it to do from a health standpoint. Again, I'm as optimistic as Sean was at the opening. Nobody's more optimistic than me, but I still think we have a lot to do to make sure that green communities in particular is required, more incentivized through both federal, state, and local policy. So I think that's an area where we have a lot more work to do. And I think, frankly, we need a stronger coalition, the groups in this room, to come together and be a unified voice and saying, hey, we have an integrated tool, tackles energy, tackles health, tackles resilience simultaneously. Let's make sure that that tool is being used appropriately at every level of government and incentivized appropriately at every level of government. And frankly, that doesn't happen without the partnership.
No, I appreciate that. And I'd love if you could also expand on how WELL is moving health and housing forward and things that we might be able to learn from that in terms of enterprise.
Well, I didn't want to take too much of the time from other panels, but I'll put it this way: that we say this about sustainability, that sustainability is a journey. Health obviously is also a journey. I think it's a little different. You got Steve Nadell here, who's an expert on energy and energy efficiency, and that's one metric, right? Our buildings are dynamic systems, and most of the factors that we think about that impact our health are completely invisible, right? And we've been spending a lot of our time saying, how do you make the invisible visible? In the last few years, we've done a tremendous amount of work in indoor air quality. I'm not wearing mine right at the moment, but a lot of us are now wearing CO2 monitors or have them on our backpacks or whatever it is. CO2 might be getting high in this room. I don't know, but it's possible. So again, and that applies to water quality. That applies to our materials. We require performance testing with WELL, and there was a project not to be named that was failing on their indoor air quality tests, and we found out like 3 months later they had brought this huge piece of artwork into the lobby, and it was riddled with formaldehyde, and it was just completely off-gassing. And they were like, why do we keep failing? What is going on? We have all these amazing strategies, increased ventilation, And it wasn't working because they didn't connect the dots, finally connected the dots and said, okay, here's the deal. Now, you put that on the housing level, right? Whether it's private sector or private or affordable housing, we have to account for the dynamic system that is our homes, right? So many different factors. We absolutely have to make the invisible visible. I think the most glaring example is things like indoor air quality, but that's really where we're pressing to make sure that we're doing more, we're more aggressive, and it goes back to the old Mayor Bloomberg line, you can't manage what you don't measure. And so we're getting into this phase. I think AI is going to accelerate it. How do we kind of get a better picture of what's going on inside the building at a more real-time monitoring pace?
Right, thank you. One thing we haven't touched on too much is that when we do resident engagement and when we are working directly with residents, a lot of times air quality, water, those are things that should be baseline protected across all buildings because it's not often coming up in resident engagement. That's not top of mind for folks, because I think a lot of people already assume those things are healthy and taken care of. And that's one thing that we worked towards in the 2026 criteria, was ensuring that for an Enterprise Green Communities building that those are. And I'm really excited to see that shift from some criteria from being optional to being mandatory in this case. And I think key to everything that we're talking about is really implementation and how it plays out in the real world. So I'd love to hear from everybody, kind of one last thought or challenge that you want to put to folks in the room around health and housing and where you want to see the field go and actual practice go.
I mean, I'll just repeat what we've been saying, which is I think the new table stakes are that health is just part of being a high-performance building. It's time. And I think what we heard from Ashley at the practice level, I think adopting as quickly as you can a health promotion mindset. I think health was so long thought of as just safety, or it was a health and safety, whereas, man, it can be so much more than that, and it is so much more than that. And I think, again, I meant to say this when you asked me about the technical working group. I think a moment that really was a pivot for us was when we essentially refreshed the Enterprise Green Communities website and the founder's vision. I'm not going to get it exactly right, but that idea of like a home is like a place for you to thrive, you know? And so we realized like, oh gosh, that's it. Like the 2026 should be about like, sure, safety, you know, sure, health promotion, but then it should be about like thriving. Like it should go beyond that. It should be your connection to a new community, a new life, a new opportunity. And so let's all embrace that.
Yeah, definitely.
I would love to leave you all with a story. So one of the first homes that we worked on, we had a resident, his name was Oscar, and Oscar had unfortunately experienced a fall in his room. Most of our homes are a bit outdated. Most were built in the 1950s. So improvements are made, and we've been doing great on that end. But Oscar had fallen in his room, and he had actually ended up in the hospital. And it was time for discharge, and Oscar did not want to leave the hospital. He was scared to go back home. He was scared to go to his room. The space was so cramped. The paint was old. It just wasn't a comfortable environment for him, and there was so much refusal to leave that the conversation actually came up of him potentially getting institutionalized because he's an older man. He's a senior. Parents aren't around anymore, and the only other place that could effectively care for him was an institution. And so we got the Tomei Aging Well Project grant just in time, and we were able to remodel the basement, provide a more expansive space for him, improve the flooring, and ensuring that he had a wide enough space and room to move accessibly and easily. He had a transformative space. He had a patio in the back so he could walk outside, and all these wonderful improvements. And so I say this to say, as you all go on this journey, that housing, it affects someone's outcome, where they end up in life. If we hadn't gotten that grant in time, Oscar would be in an institution right now. And so knowing that this work that we're doing isn't just another remodel, like we were saying, it's not just another home or a building, it's truly saving a life and allowing people, especially people with IDD or folks that may be different from us all, allowing them a place to truly thrive and have that well-being in.
Right.
Here. I'll be brief but emphatic. 2 words: strings attached. I think, every time there's public finance, public dollars being spent, it should be requiring something like green communities. And that means to me that we've got a lot of work to do. Every time there is a federal program. There are utility programs that are now investing in energy efficiency. Is there a health component to that investment? I think when there are public dollars involved, we need to make sure, as the video said at the very end, that there is quality assurance. And that means energy, resilience, and health. And if we're not requiring something like green communities, I think we could be falling short because there's not going to be that same amount of accountability. And again, I think it's a really important moment. Krista talked about where do we go in the next 20 years. We should make sure that every single affordable housing, major renovation, or new construction is absolutely including as a foundation health, resilience, and sustainability. And that's the opportunity. Every public dollar ought to be requiring this.
Thank you. Yeah, thank you all for joining us so much. We really appreciate having you all today and your perspectives and leaving us with such great words of wisdom. Because I think if we learned anything today, it's that health is not a new concept when it comes to building science, and that we need to start implementing this, that it makes a big impact. We have the tools, we have the resources, and hopefully we all walk out of here today excited with how we're going to approach health within our own building. So thank you all.
Thank you.